Hello, welcome to Take 10 with the Tennessee Tribune. I'm Sandra Long-Weaver, and I'm the editorial director for the Tribune. And today, our guest is Monique Anthony, who is the director of the Office of Minority Health and Disparities Elimination. So right off the bat, Monique, I'm going to ask you, what does that mean? Disparities and Director of Health and Disparities Elimination.
Yes, well, thank you. First of all, I would like to say thanks for having me here today.
Yes.
And so, the Office of Minority Health and Disparities Elimination, it's the office that's housed within the Tennessee Department of Health.
Okay.
And the office was created as one of the state offices across the country. There's a National Office of Minority Health that was established to really touch on the impact of the burden of disease in minority populations.
Are there specific diseases that you look at more closely, or?
Yes. Well, right now the focus, especially from a department-wide standpoint, is primary prevention, and that includes looking at what we consider the Big Four.
The Big Four?
Yes.
Okay. And
So the Big Four is tobacco use, physical inactivity, obesity, and substance abuse.
okay.
And so under the umbrella of primary prevention as a whole and looking at those areas of chronic disease, we try to dig deeper into what does that look like in terms of disparities within racial ethnic minority populations.
Okay. And so you focus primarily on African Americans, Asian Americans? How does?
Yes, well, traditionally the office has focused primarily on African American and Hispanic Latino populations, but we would like to expand our approach in that the landscape of Tennessee is changing. We are increasingly population of minorities coming to Tennessee. And so we want to make sure that we're focusing not only on African Americans and Hispanic Latinos, but looking at our Asian Americans, looking at Native Americans. And so we want to make sure that in expanding that approach, minority health encompasses those health issues that not only cross racial, ethnic, but cross culture, cross gender, and geographic boundaries.
Oh, cross gender as well.
Yes,
Okay. That's
yes.
interesting. I want to go back to the Big Four and start with tobacco use.
Yes.
So there is a push to encourage people to stop smoking, or I guess not even to start smoking.
Yes, so like I said earlier, our approach is trying to move upstream in terms of of addressing health in terms of primary prevention, meaning that we want to make sure that we attack it before injury, the risk of injury or disease occurs. Meaning that, like you said, for tobacco use, we want to make sure that a person never starts to smoke, and which in turn would ultimately help us or help that individual not to become addicted.
Okay. So what are you doing to go more into the prevention area? Are you starting with teenagers or even middle school children, or where?
Yes. Well, we look at various levels. We look at the individual level and the family level, and we look at all ages. We want to make sure, especially with tobacco use, we work with our chronic disease program within the Department of Health, looking at the risk of smoking on pregnancy, looking at the risk as it relates, like you said, to teenagers, especially now when there's an increase of teenagers use vaping.
Yes, I was going to ask about that. So I don't know that there have been a lot of studies about vaping, but can vaping still lead to the same types of chronic diseases that we see in the population?
Yes, well, I
People who
don't
smoke.
claim to be an expert on that, but definitely based on the literature that I have seen, studies have shown that they don't know exactly what all is contained within those instruments that they use for vaping. However, there is some form of nicotine in there that potentially would cause a person to become addicted.
Okay. And so, and the addiction can lead to chronic diseases like
Such as like lung
lung cancer. Okay.
chronic, emphysema, COPD, things of that nature that all are impacted by the behaviors of smoking.
Okay. All right. So that's number one of the
Yes.
big four. So number two was
Obesity.
obesity. Okay.
Yeah, right now, Tennessee is ranked fifth in the nation in terms of obesity. And
Wow.
as we are increasing in terms of not only childhood obesity, but adult obesity in terms of seeing that increase in obesity. And so we want to make sure, and obesity is also one of those other chronic diseases that are impacted by other behaviors. It's
Such as?
not only through not only through just sorry, I lost my train of thought.
That's all right.
So obesity can also be impacted by your emotional and mental health as well.
I see.
Outside of just the behaviors of living an unhealthy lifestyle in terms of poor eating habits. There are other facets of your health that could also lead to obesity in terms of stress, in terms
I didn't
of
think about stress. Okay.
yes, which as a result of stress, people tend to find ways to cope with stress. For some, it may be emotional eating, which could in turn lead to poor choices
Right.
in eating, which could ultimately lead to, if you're not really paying attention, to obesity.
Wow. Okay.
And that's just one small piece, but
Okay. It still
yeah.
can become a major issue.
Right.
And number three,
The third one, physical inactivity.
physical okay. So
Yes.
you must get up and exercise.
Yes.
Even if it's just walking.
Yes. And all of these four health issues are interrelated because obesity also correlates or go hand in hand with physical inactivity. When you're looking at improving your overall health, you want to make sure that you are developing healthy eating habits, as well as making sure that you are getting the appropriate amount of exercise or that you need in order to make sure that you're functioning at the level that you need to in order to live the lifestyle that you choose to live.
Right.
And
That's important.
and not being as physically active and poor eating habits can definitely be a detriment in terms of having optimal health for all.
Okay. And this affects all ages.
All ages, yes, yes.
Okay. And the last number
It's
number
substance
four,
abuse.
substance abuse. Okay.
Yes.
So, and we know there's a lot of talk about Tennessee and opioids.
Yes.
But that's not the only substance abuse that we see.
Right. Yes, of course, outside of opioids, you have your other illicit drugs that some populations may tend to gravitate to, or not necessarily gravitate to, but maybe their method of choice than others.
Okay. All right. And so, how is what's in store from your department? Are there other awareness activities that are taking place that we should know about? Anything coming up?
Yes, well, our office, we partner and engage internally across divisions in terms of addressing disparities, specifically the four that we've been talking about so far. The Office of Minority Health does not provide direct services, so we provide a lot of technical assistance as well as consultation across the divisions, as well as to our external partners in addressing disparities.
Okay, all right. Well, thank you very much. Oh, and if you want to learn more about disparities, can that be found on your website, or how can we learn more?
Yes, you can go to tn.gov, Minority Health.
tn.gov Minority Health.
Yes.
All right. Well, thank you, Monique Anthony, for joining us today. We appreciate it. I've learned a lot about the Big Four, and hopefully you can, again, find out more information that can help you and your family at tn.gov Minority Health. I'm Sandra Long Weaver. Our guest today has been Monique Anthony, who is Director of the Office of Minority Health. Thank you.
Thank you.